Hello, everybody, and thank you so much for making time to join me again today as we share on today's topic. So, today we'll be discussing a very common household name, a health condition that affects a lot of people. In the recent past, it used to affect mostly the elderly, the mbuyas, but recently it has been seen to also affect the younger people. I'm sure some of us have either read about it, either seen it in our parents, in our friends and relatives, or we could be living with it. Right. And this is a stroke. So now the question is, what is a stroke? So a stroke in simple terms is loss of function on one side of the body. Loss of function of one side of the body. So it could either be loss of function of the right arm and the leg at the same time, or it could be loss of function on the right side of the arm and the leg at the same time. But then, what causes me to lose function? Why? So there are several factors that play a lot of roles in leading to a stroke. Most common is high blood pressure. By me saying high blood pressure, I'm going to dwell more on neglected high blood pressure. Okay, so now what is high blood pressure? So we are human, yes, and we have our head, we've got our hands, we've got our legs, and we also have, when you hear of blood pressure, the first thing that we think about is the heart, because that is the machine that transports blood to the rest of the body parts. So now, a stroke would result if there is disruption or interruption of blood supply in the brain. The brain is the boss of the body. It is the biggest machine of the body. So if it is deprived of some blood or some oxygen for an amount of time, that could lead and result into a stroke. Let me explain it in such a way. The major blood transporter is the heart, right? So there's so much blood in the heart. And then the heart uses blood vessels to transmit or transport blood to all parts of the body. So the blood vessels are like hose pipes. A hose pipe, like the one that we use when water in the garden, a hose pipe. Yes. So we have blood vessels that are like hose pipes where blood passes within. So the hose pipes are going to transport blood to the rest part of the body, to the head, to the arms, all body parts. But depending on which side or depending on which part of the body the blood transports, blood vessels in size differ. Okay, blood vessels in size differ. An example is the blood vessel that will be supplying my arm will be quite big enough. Yeah, it could even be maybe as big as, I'll use this. Yeah, it could be as big as that. If it's there, blood can be passing, and yeah, the blood vessel can fit in there. But we can't have the same size of the blood vessel passing in my finger, almost same size, no, or my little finger, and this again can't pass in my brain. So we need a smaller blood vessel. So how the body is designed is that from the major blood supplier, we have big hose pipes, the big blood vessels. And as they are transporting blood to smaller parts, the blood vessels begin to branch into smaller blood vessels. So, for example, we have this in my arm, and then we might have something as small as this passing through my finger, for example. Just an example. So in the brain, we also have blood vessels, but in the brain, we've got very tiny blood vessels. We do not have big blood vessels. We need to have tiny blood vessels. So now, when the pressure is big, when the pressure is too much, the blood vessels try to expand, like they expand so much to let the blood pass. But because the blood vessels are too small, too narrow, sometimes it can just burst. So that is one way in which high blood pressure could lead to blood vessel rupture within the brain, and then also lead to a stroke. So another thing that could lead to a stroke could just be illness. You know, if you watched the other topic in cerebral palsy, we talked about how illness could enter the body and find its way through the blood vessels or other means to the brain. And if an infection reaches the brain, you know how infections are. Infections just destroy. So it will reach the brain part and start eating it up, or it will cling onto the blood vessel. You know, this is a blood vessel, and we've got infection that keeps on depositing, and then they'll cling onto it, making it tighter and blocking it to transport blood to the rest of the brain. So again, infection could lead to a stroke. Also, our social behavior activities can also lead to a stroke. What I mean is there are so many social activities that put us at risk of developing a stroke, but I'll just talk about the very few common, which are alcohol consumption. I know we live in an environment where we just, you know, Christmas, we go and drink. It's a party, we go and drink. Yes, we can drink, but sometimes the drinking puts us at a higher risk of developing a stroke, because just the same alcohol will now increase the levels of fat in the bloodstream. Okay, so what the alcohol does is that it might start um, leading to an accumulation of mafuta or fat within the body, and this fat may find its way into the bloodstream. For example, I'm sure most of us have seen offals, you know, relish offals. Have you seen how the plate becomes after you eat it? The plate imayuma, it dries up, and then the fat is easily visible there. So now imagine that fat finds its way in the blood. Can you see this? In the blood vessel. So here it can easily pass. You see it has come this way. It can easily pass. But then there are times that, oops, you can see. There are times that the blood vessels, this is a big blood vessel, so it doesn't cause much problem, but it might find its way into the smaller branches and then might fail to enter or to pass through this smaller blood vessel. And then by so doing, it might just end up blocking. So we might just have a blocked blood vessel. I only hope this could make some sense. I don't know. Yeah, but as it is passing, it might, since it has failed to pass inside, it might block. You know, it just blocks, it fails to pass. So meaning blood fails to be moved along the rest of the blood vessel, which leads to the other side where the blood is supposed to reach fails to reach, meaning that side is being deprived of oxygen, of blood, of nutrients. And if something is deprived of food, what happens? It starts to lose its energy, it starts to become weak, and eventually it might just lose its function. So now that is what happens when blood vessels are blocked. So you find that when a blood vessel is blocked, the side where the blood is supposed to supply is deprived, and it stops functioning because it has been deprived. It's not working anymore. So other causes of a stroke could be injury. This injury could result from falling, for example, or a road traffic accident, which could just damage the brain. So now, what are the signs and symptoms of a stroke? Fine, we've talked about how a stroke can come, but then what are the signs and symptoms? How do you know you might be having a stroke? So number one, in most instances, is a severe headache. And most people have described this headache as the worst headache in their entire life. Just from nowhere, sometimes you feel a very terrible headache. That could be a sign of some damage happening in the brain. It could either signal that there's rupture, you know, where the blood vessel bursts, because the brain is supposed to be good, supposed to be healthy. It shouldn't be disturbed in any way. So if there's something wrong, it will signal by giving you a headache. Sometimes you start seeing lights, you know, just lights. Even when the room is dark, you just be seeing flashes of light everywhere. That could signal either a high blood pressure or something wrong within the brain or the blood vessels. Okay. So now we've talked about all these causes, but again, the thing is, sometimes a stroke can happen gradually, where you start feeling weakness. You know, today you wake up, you're just feeling weak. You can walk, yes, but you just don't feel yourself. You know, you just feel something's different. You're trying to lift something, but your arm may be a bit weak. It's not holding. Maybe it might, but a bit weak. Sometimes, even as you're walking, you might be limping. People might think that maybe you've just injured yourself, but or maybe you're tired. But you start dragging your foot like you're limping, and it might just be for a day or two, and you come back, everything becomes fine. So when that happens, that is known as a passing stroke. It is a signal, and if we experience that signal, we have to make sure that I'm looking at time. Yeah, so if we experience those symptoms, we have to make sure that we seek medical attention as soon as possible before the major stroke comes, because this small weakness is a sign that a bigger stroke might come, and we don't want a bigger stroke. No, we don't. Okay, so sometimes again, you find that, okay, you're fine, you know, I'm here right now, very energetic, very healthy, very fine, and then I go to sleep today at night. Tomorrow morning I wake up, then I fail to move my arm. I'm trying to move it, it's not moving. I try to move my leg, it's not moving. This side is moving, this other side, nothing. What could have happened? So sometimes the weakness comes in gradually, where you can feel the weakness over some days. Sometimes it just happens suddenly. And in many times, what causes it to happen suddenly is when we have a blood vessel rupture. That is just sudden. Because if we had Mafuta in the blood vessel, as it is passing, to be giving you signs and signals to say there's something wrong within the brain. As it is passing, it might be blocking. Eventually, it blocks. But other times, it might just be a burst. So sometimes it could be a burst, or it comes in gradually. Now, there are certain characteristics that are observed in persons who've got different-sided strokes. For example, if a person has got a stroke on the right side, very evident in most people is that they lose their speech. Okay, they lose their speech. So now there are two types. It's either they lose their speech, they fail to talk, or they fail to understand what you're saying. Okay, most times when a stroke happens on the right side, if it affects the right side, it also affects the machine or the center of speaking. I'm going to use this. Yeah, I'm going to use this, sorry. Yeah, so imagine this is the machine for speaking, and it is placed somewhere, you know, it is placed somewhere. So this is where the blood vessels pass, you know, they pass like this, passing like that. So now, this side of the body, this side of the brain, what can I say? This side of the brain controls the opposite side of the body. And this side of the brain controls the opposite side of the body. So in most instances, we find the speech machine on the left side of the brain. Okay, so now when this blood vessel has been ruptured, meaning this part of the brain, the machine, also is deprived of some oxygen. So when the person starts presenting with right stroke, they'll also present with some problems with speaking. So when a person has got stroke, it's not deliberate that they don't want to hear or to speak to you. It's because the machine has stopped functioning correctly. So depending on how much the damage to the blood vessel has been, sometimes it can it can repair-ish a bit. Okay, it can come back to normal-ish somewhere. Okay, but if the damage is too much, we can't do much to repair the speech center. Okay, so in some other people, it could be the left side. You find that people who have got a stroke in the left side could have a very, very short temper. Okay, sometimes their memory could be lapsing here and there. Why? Because the machines, the machines of memory and maybe emotions could be this side. So when that blood vessel passing this side has been affected, this other side will also be affected. I hope we I hope we're together. Yes, time has gone. I'm so sorry that we have taken so much time, but I, I don't know whether we should continue. Okay, let's continue for the next 4 minutes. For the next 4 minutes, and we'll be done. Yeah. So we've talked about the signs and symptoms. Now, what happens after that? The moment you see the signs, the moment you start feeling the signs, rush to the hospital. Rush to the hospital. Okay. Health centers will be there to help us correct the blood pressure or reduce the risks of that which we are feeling, blocking it from advancing into a frank stroke, a concrete stroke. Okay, so after we got to the hospital, they've given us some medication, or maybe they've admitted us. We are going to be discharged, and not everyone upon discharge is as back as healthy as they were. Okay, they might lose certain function, and if you stay home with that weakness, very little improvement might result. We need to seek further management. And the common mainstay of stroke management is physiotherapy. Okay, so physiotherapy is going to help retrain the function that was lost. Okay, they are going to help strengthen the arm or the leg. They'll help you be able to do the things that you were doing way back. They'll help you be integrated back into society. For example, if you were a teacher, physiotherapists are going to help you do function that will enable you perform as a teacher or as sports person, anything. Physiotherapists do help a lot. Just make sure you abide by the exercises that you're given, you abide by the medication you are given, you abide by health precautions, and that way would work hand in hand together. So thank you so much for making time to join. I know this is quite a long topic, but we've just compressed it. I hope some of us have understood why certain things happen. Okay, so it seems time is not on our side. As I said earlier, this is quite a long topic, but I hope that a few of us could at least have understood a few things that we have discussed today. Maybe we could have learned something. So we are going to make time next time to discuss stroke in detail. Yeah, so for now, I'm going to say thanks so much for watching, and we'll see you next time. If you've got any comments or suggestions, please place them in the comment section, and I will be glad to respond to them. Thank you so much, and have a beautiful, healthy time. Thank you.